Fibroid tumors, what are they and why are so many African American affected by them? One woman tells her story. That's up next on Another View. Hello and welcome to Another View. Black women and uterine fibroid tumors. According to studies, black women are 2 to 3 times more likely to develop uterine fibroid tumors than white, Latino, or Asian women. And fibroids also tend to be larger and occur at an earlier age. Today we're going to take a look at some of the choices that women face when they are diagnosed, including having surgery. And we'll discuss why black women are disproportionately affected. Part of the problem with fibroids is that many women are unaware of what they are, or they get misdiagnosed, or simply ignore the pains, and often the symptoms are silent. Well, we wanted to get a sense of what people knew about fibroid tumors, so we asked, and their responses were very revealing.
The doctor told me after, your usual yearly screening, so I found out that way. Didn't have any symptoms or anything.
I'm fine. I don't have fibroid tumors, so I'm good. So, no, I'm not concerned about it.
It's a tumor that grows, I think, in the woman's womb or stomach or something. I have heard about that.
Some people have gotten them taken out and they grow back. So, I had a whole hysterectomy.
I know sometimes young ladies have them, but it's basically during the time of the month, and to my knowledge, they normally pass, with each cycle that she has.
I had them removed. I was in my early 30s, and they told me if I wanted to have children, that'd probably be a good idea.
Well, it's a female issue. Okay, that's about as much as I know.
Well, we're doing this show so that people will know about fibroid tumors and how they can be treated. And we're going to do that through the eyes of a very brave woman named Cassandra Williams, who recently had her fibroids removed. But first, before we see her story, we're going to meet the doctor who removed her fibroids, OBGYN, Dr. Andrea Price. Thank you so much for being with us today.
Hello.
What is the biggest misconception about fibroids? I saw you grimace a little bit when you heard the responses from the people that we talked about, and that fibroids go away every month, for example.
Yeah, actually, that was a new one. I never heard that one before. But probably the biggest misconception is that they're not treatable, and there's really nothing that you can do about them.
Mm-hmm. And the fact that black women are affected so disproportionately when we talk about white women and Asian women, Latino women, is there a reason for that? Because that's often what we hear when it comes to fibroids, that black women just get them so much more often. But why is that?
Because there's a hereditary factor, and it just seems that African American women are more prone to fibroids. But since as physicians we don't really know what the cause of fibroids is, it's hard to say exactly what factor it is that does make them more common in African American women.
So in terms of the food choices that people make or healthy living styles, does that matter at all?
Absolutely not. You will either have fibroids or you won't, and what you eat or your exercise, yes, it can make you healthier, feel better, but it's not going to affect your fibroids.
I know that fibroids and where they are located in a woman really makes a difference in terms of what her options are. What are some of the options compared to where the fibroid is positioned in a woman's body, and what will determine what her treatment options are exactly?
Well, there are two things that determine whether or not A, a woman needs to be treated for fibroids, and B, what the treatment options are. The first is the size of the fibroid, because the size of the fibroid will often determine whether she's eligible for a more conservative procedure, such as a laparoscopic myomectomy, which is the minimally invasive belly button surgery, or whether she has to have an open incision that's more similar to a cesarean. Also the location, because if the location of the fibroids is in such a spot where it's affecting the lining of the uterus, that's when it tends to cause a lot of excessive bleeding and cramping. Or, for example, if fertility is an issue, if the fibroid is in an area where it could be blocking a tube or affecting fertility. So those are some of the factors that need to be taken into consideration.
And if your mother does have fibroids, does that make you a candidate to look for fibroids, let's say, in your 20s, or is it your 30s? Or when should a woman begin looking for fibroids, especially if her mother has them?
Well, typically if a woman is asymptomatic, they don't really come to our attention unless A, they're very large so that we can feel them on their yearly physical exam, or B, if a woman gets an ultrasound for another reason, then we may find an incidental finding of fibroids. But typically, if a woman starts to complain of a rapidly enlarging abdominal girth or pressure, excessive pain, or bleeding during the periods, at that point we will do a workup and we will look for fibroids as a possible cause.
Generally, when women come into your office, what are some of the symptoms that they have? I've heard of lower back pain or things that feel like cramps, or even when we hear Cassandra's story, she likened her symptoms to being pregnant.
Well, usually the larger the fibroid is, the more symptoms someone may exhibit. And when a fibroid becomes very large, that's when you start to exhibit symptoms of pressure, cramping. You may have urinary frequency because a fibroid is sitting on the bladder, compressing the bladder, causing you to feel like you have to go to the bathroom more often. You may have constipation simply because the fibroid is in the back part of the uterus and it's laying on the bowel and it's actually mechanically interfering with things moving through your intestine. If a fibroid is next to the lining of the uterus, you may notice that you have excessively heavy periods, which may make you more prone to anemia. So many of these women become anemic because they're just bleeding heavily month after month after month.
Right, and I hear that a lot from women. Now let's talk about Cassandra for a moment because we're about to see her story. What were some of her symptoms when she came to see you?
Cassandra's symptoms were that she was having very painful periods, and she was also feeling sort of constant pressure in her pelvis. And her periods were very heavy, and she was having anemia. So those were 3 of her symptoms. And as the years passed, she just noticed that the symptoms were getting progressively worse, especially the symptom having to do with the pain and the pressure.
Right.
And it basically got to the point where she felt like she couldn't live with it anymore.
And what we're about to see is a little bit of her surgery. Explain to me what we're about to see now. She had a myomectomy, correct?
Right.
Okay.
Yes, Cassandra had a procedure called a myomectomy where we actually make an incision into the wall of the uterus and we remove the fibroid tumors. The thing that was kind of unique about Cassandra's surgery is she is new to the area. She was not working with her employer very long, so she could not afford to take much time off of work. So we took what we call a minimally invasive approach, where through several tiny incisions through the belly button and in various places on the abdomen, we were able to remove the fibroids using the laparoscope, meaning that she will be able to return to work in approximately 3 to 4 weeks instead of the usual 6 to 8 week recovery time.
All right, well, let's look at her story. Cassandra Williams wondered why she was having such severe cramps and bleeding during her menstruation. Over the past few years, she went from doctor to doctor and was misdiagnosed, receiving treatments that failed. But as she put it, she listened to her body until she finally got the right diagnosis and treatment. And now her story from the operating room to the recovery room. It was a long journey for Cassandra, but it was one that began long before she had symptoms because her mother also had fibroids, a sign that Cassandra knew increased her likelihood of getting them.
She was just passing out. She was not feeling well. She was fainting. She had gained a lot of weight like I have, and one day it just got to be so bad that we had to call an ambulance to revive her, and they took her immediately to the hospital and found out that she had fibroids resting on her bladder, and it made her really sick, and it had been there for years, and she didn't know it. She had a full hysterectomy. That was her only alternative during that time. It was a while back. It was when I was a teenager, so I don't think they knew at that time the other alternatives that I'm introduced to now.
Hi, Cassandra. Okay, we're just going to do a quick listen to your heart and lungs, okay? Fibroids are actually, they're tumors that form in the muscle of the wall of the uterus, and they're just made of fibrous tissue, and they tend to form balls or whorls of tissue, and they think that they all grow from a single cell. Nobody really knows what causes them. They tend to be hereditary. 50% of women have them. They're extremely common. 70% of African American women tend to have fibroids, so they're even more common in African American women.
I liken my symptoms to pregnancy symptoms. I had irregular periods. They bled longer. I would spot. I would have pains, longer menstrual pains, and it wasn't the normal period that I had, so I decided to go to a doctor and have them checked out.
The symptoms of the fibroid many times just depend on exactly where it is. Like if the fibroid is laying against the lining of the uterus that sheds every month when you have your menstrual cycle, those tend to cause heavy bleeding. So something that's even as small as this grape or smaller can cause significant symptoms if it's in the right spot. Now, the advantage of the minimally invasive or laparoscopic surgery is that you have very small incisions, you have a shorter recovery time, and typically, depending on how things go, you'll be able to go home either that evening or we'll send you home the next morning. And I know that you were very anxious about being off of work. Her largest fibroid in its largest dimension is about 5 centimeters, so it's sort of like halfway in between the size of this plum and this apple. That's her largest one. And then she has possibly a couple smaller ones, one that's probably about the size of this walnut, and maybe one that's about the size of this grape.
I'm not the only one in my circle of friends who have had this surgery. Quite a few of my friends have had this surgery. One of my friends just had it in December. I do have quite a few fears. Surgery is quite difficult. It's a cut, and I'm worried about that. I'm worried about the time frame of the healing. I'm worried about the side effects. It's just a natural fear, a fear of being under anesthesia, a fear of not being able to wake up after the anesthesia, the pain that's associated with it, just normal feelings.
We'll actually be cutting into the muscle of the uterus, across the top of it and the center, and then dig out the myoma underneath. You know what I'm talking about, I mean? The fibroids, like I said, they tend to be in a round or world shape.
Harmonic scalpel?
We'll actually be cutting over the muscle that's overlying the fibroid, and we'll actually be shelling or actually digging the fibroid out. They tend to have a capsule, we call it, which is like fibrous tissue that surrounds it. And we sort of get into that capsule and we just kind of almost scoop it out using a special instrument that cuts and actually controls bleeding while it's cutting, called a harmonic scalpel.
It's really some compelling video. Now, as we mentioned before we went to that segment, you mentioned that she had a laparoscopy. I think a lot of women are concerned about hysterectomies in general.
Right.
When in general is that the only option?
When the fibroids get so large that it makes the myomectomy just a very difficult procedure or impossible. I've had women come to me with fibroids that were the size of a 6-7 month pregnancy. And at that point, you've pretty much run out of options because it is very difficult to reconstruct the uterus because it will cause so much damage to the uterus to remove the fibroid that there won't be enough tissue to put back together. So it is very important that if women are symptomatic and they think that they may have fibroids or need treatment, that they not delay. Because
now it's 6 or 7 months though. You're feeling that. Can you physically see that, or is it?
You can physically see it. It looks like you have a pregnancy.
Okay, so when someone's waited 6 or 7 months and their fibroid is that long, is that big, they've obviously just waited too long. I mean, especially if you can see it.
Right, and I run into that a lot with my African American patients, where they wait so long that myomectomy is no longer an option. Therefore, preservation of their fertility is no longer an option. And that is my number one issue or message that I would like to get out to all women, is that if you have fibroids, that you really need to see about them, especially if you notice that they're rapidly growing and enlarging from year to year.
I understand that fibroids should not necessarily be linked to infertility, and I think that's another misconception.
Right.
Can you clear up that misconception for us here?
Right. Typically, unless a woman has had 2 or 3 miscarriages, we don't consider fibroids a cause of infertility, because there are many women that have normal pregnancies and normal deliveries with fibroid tumors where the fibroids don't at all affect the uterus. They tend to, the uterus grows, the fibroid does tend to degenerate a little bit during pregnancy and may actually shrink in size, but unless the fibroid is in a location where it is physically blocking the cervix, which occurs sometimes where a woman will have to have a C-section because of a fibroid, or sometimes because the fibroid tends to degenerate a little bit, it will cause some cramping or preterm labor symptoms, but in general,